Helping Seniors Television, all about improving quality of life for seniors. If you're a senior, know a senior, or plan to be a senior, then this show is for you. It's all about helping you develop your own aging plan so you can age actively and with dignity. Helping Seniors Television from the Helping Seniors Network of information, education, and resources.
I'm Kerry Fink with Helping Seniors of Brevard, and what a pleasure it is to have you join us today for Helping Seniors Television. I have the privilege of sitting in for our president and founder, Joe Steckler, and as you know, Helping Seniors of Brevard is a Florida nonprofit, and we are dedicated to helping you create an aging plan so that you will be educated and informed and prepared for all the things that we need to think about along the road of aging. And so one of the things that you may know is that Helping Seniors operates the county, the Space Coast areas, Senior Information Helpline. And I'm going to give you that number in just a moment, but we get between 75 and 125 calls every month, and we help these folks free of charge as a charity organization with finding and getting connected to resources that will help in almost any kind of situation. We get calls on everything from medical to transportation to legal to financial, all sorts of questions, housing. It runs the gamut, and you can call us at 321-473-7770. 321-473-7770. And again, that's a free service that Helping Seniors of Brevard does. The other thing that we like to do in the Helping Seniors organization is get information, we call it outbound information, and that means helping you think about the things that will help your own personal situation. And I think you're going to find today's program fascinating on that level. So what we're going to talk about today is 5 steps to finding the right home care provider. And I'm so honored to have in our TV studio today, Kelly McDavid-Rallis with Home Health Care Resources Corporation. Welcome to the show.
Thank you. It's so great to be here.
You know, we're talking about this, that all our life we're told about making a plan. So when we're younger and in school, the older folks tell us, well, what is your plan when you get out of school? You should plan if you're going to need college, if you need some training. What is your plan for your career? Then as we get older, they say, well, are you planning for your retirement? Are you planning if your kids need to go to college or things like that? So we're always planning. And then we get towards retirement age. And then the question is, do you have an aging plan? It seems logical that we should, but it's amazing as we go down the road, most of us haven't given that aspect that much thought. So when we run up onto situations of home health care and things like that, we're usually making decisions not necessarily with the best forethought. And I would think, like with any other proper good planning ahead is going to help us a lot. And that's why I'm so excited about today's show, because you're going to help us kind of work through some reasons that, first of all, I'd like to start with a question of, would you describe how you define home health care? So maybe that's because a lot of us don't even know how that fits into the things that we should be thinking about as aging. And then we'll talk about, once you understand that, what are the right steps to choosing the right provider?
Home Health Care Resources Corp is a non-skilled, non-clinical home care provider service. So what that means is we can help with personal care. We can help someone take a shower, toileting, any kind of personal needs. We can help someone with homemaker services, which are light housekeeping, laundry, meal prep. We can go grocery shopping. We can take people to the doctor. We can also help them with companion care. So maybe someone lives alone and there's no family in town, or someone has to go out of town for a reason. We can help and just be there to provide that comfort and also help with safety measures. We also provide respite, which goes along with companion care for longer days. So we can be there as little as 4 hours or as much as 24 hours, 1 day a week, or 24 hours, 7 days a week.
You know, one of the things that you pointed out was the need for getting somebody in the home from time to time, because if you don't have reliable family members, or even if maybe you have family members close by who care, but just the reality of their schedules makes it impossible for them, with the work or the travel and things that they may need to do, they may not even be in a position where they can help. And then, we talk about this so often too, that people often will pull a number off of a bulletin board and they don't know who the person is, and they're inviting them into their home to maybe help with some housekeeping or something like that. And then we see the sad end to some of those stories because the person wasn't who they purported themselves to be. And I guess it really just comes back and makes us really want to have that conversation that if you're going to look at getting somebody to come into your home, and I think that's a point that we probably should talk about here, because it sounds like when you talk about home health care resources, you're doing a lot more than just what I would call specifically health care.
Absolutely. We are the full gamut of resources. We help someone if they have additional needs, whether it be financial, whether it be durable medical equipment and they need a wheelchair, a walker, a bedside commode, or a toilet riser or grab bars, or literally they just need help getting access to Meals on Wheels or other services that our community provides. We can certainly help them. I help navigate in between, whether it be with their physicians, helping get additional orders for physical therapy, respiratory care, just you name it. Anything that someone could need while they're aging in place, I can assist them with.
We were talking just this week about this concept of living at home safely and independently. And most people, that seems to be their preference. I like my house. I want to be here. I want to grow old in my house. But doing it safely is another question, isn't it?
It absolutely is. That's why every time that we come in and we start a new list of services, a new schedule of services, we also complete a safety assessment.
Okay, tell us what that means, because that's a very important thing. I think we always hear falls in the home is a real bad news thing as we get older.
For us, it's learning about a client's ambulation abilities. Can they walk on their own without assistance, or do they need a device, a supportive device for assistance, like a walker, a wheelchair? They use a cane. What is their level? Also, we look around the home for cords, like from lamps or area rugs. We look for things that could catch their feet and could cause them to trip or to fall. We look in the bathroom. We want to see that there's grab bars, that they can enter into the shower safely. Do they have a shower chair? So we're looking at all of those things, and we're very analytical and taking lots of notes and having just a wonderful, casual conversation about the things that help them every day and how they go about, being able to complete their activities of daily living. And as we see things that are alarming to us, that they could become a potential hazard, or maybe they've had a fall history, we really want to get all the information that we can, because it helps us to get all of the information, assess and actually see the living environment so that we can make recommendations, and also, again, work with those physicians to get prescription orders for those devices or materials that could help make them safer, and then we can help them get coverage or reimbursement through Medicare, or get Medicare to pay for those services.
And one of the points that you're bringing out, which is so important about what you are able to do in helping people, is not only do you have the experience, so the problem would be, even if I'm like a caring son or daughter, I would think of things that I might think of, but I really don't have the experience that you have. So when you walk into somebody's home, you're able to identify things that go well past the obvious.
Absolutely. A lot of people don't think about even someone who's able to transfer, like they can go from the bed to a wheelchair or to a walker with a seat, and then maybe they don't have a transfer board. Or they don't have a gate belt. So there's extra little things that we can do that can just provide those extra little resources and extra tools and information and education to keep everybody safe.
And I've also heard this said many times, and you could probably comment and see if this sounds right, but I've heard, the problem, if we have a fall, not only is it damaging and sometimes non-recoverable once we hit a certain age. But it also becomes very, very expensive just in the hospitalization, and then physical therapy, occupational therapy, and the things that you work through to kind of get back to where you were before the fall. So not only is it very expensive financially, but in addition to the damage physically, but boy, it really seems that you could take so much of that out of the equation through just a small bit of expense on the prevention side.
Absolutely. Prevention is key. It helps us to live longer and to age more happily and healthy in our homes. And you're right. When you have a fall, and let's say you crack your shin, or you have some fractures in your shoulder, chances are you're not able to stand and ambulate at all, or put any weight on on your leg. Perhaps that limits your mobility significantly. And oftentimes the physician is going to recommend a skilled nursing facility and getting rehab to get you stronger, so that you can at least transfer yourself, so that you can maneuver safely. Even if we were to provide skilled therapies in home, you're not going to get to go home right away. You're going to be in the hospital for a couple of days, then you're going to be transferred, if there's a bed available, to a skilled nursing facility. So we can prevent and definitely reduce all of that headache. It's an absolute headache, and it's frustrating for the families, and we really want to take the frustration away from the families and the clients and say, let us be here to help guide you. Let us be that extra set of resources for you, and we can definitely help you and give you all the information and the tools that you need.
You know, and on that same thing, I was just thinking about even the things that we do around the house. Like, you know, we think about somebody who may be 70 or 80 up on a stepladder trying to change out that battery in their fire alarm. They're trying to be safe, but think about the risk that they put themselves in just at that moment of trying to be safe.
Well, oftentimes too, you know, we're trying to save space, and we're trying to maybe, you know, we've already done a downsizing, and now we have a little smaller kitchens, or we have smaller closets, and we're putting things higher than they should be for our safety. We can certainly help and be there as well, like if we're doing some housekeeping or pantry organization, and kind of learn what is something that they utilize more frequently, and make sure it is in the right level, that it's definitely within arm's reach, and they don't need even you know, a couple inch high step stool, let alone a step ladder.
You know, and then there's another factor too, because I really was thinking, like, if you're able to help somebody in the home with things like grocery shopping or things along those natures, you're probably helping on the nutrition level, because, you know, if we're going to be healthy and do well, if we're not eating right, then we don't really you know, that's going to be much to our detriment too.
We really do help with nutrition assistance. So we can help with anyone who is diabetic, who is maybe was doing a keto or a paleo diet, or they're vegetarian. We can work with all nutritional needs and ensure with the grocery shopping and the meal planning. We can also do that along with the meal prep. So we can go to the grocery store. We can come back and we can do a couple of meals and have them ready to go, even freeze a couple, so that they have nutritional meals ready to go that meet their dietary guidelines.
See, and that's so important, because there's another thought that we talk about a lot. When we get calls on the Senior Information Helpline here at Helping Seniors, which is 321-473-7770, 321-473-7770. It's interesting. A lot of times we'll get a call directly from a senior who themselves is saying, listen, I might need help with this or that. But oftentimes it ends up being the adult child of a aging parent who is living here in Brevard, and we get the call from, they're someplace in the Midwest. They're calling us from Chicago, or they're calling us from Indiana or something, and they're saying, listen, I was down visiting mom or dad, and I'm really not sure they can manage all this on their own. So they're calling us looking for a connection to help. And then I was thinking the other thing is, even if you're a adult child of an aging parent and you live locally, you're still, you know, they call it the sandwich generation, where you're trying to raise your kids and you're also trying to take care of mom and dad. And you really need not only help, but you need help you can trust, that really can kind of come alongside and help you get the right or the best outcome for mom and dad on these things.
Well, we're really here to take up the burden off of everyone, and just to let people know that there are a full gamut of resources available that really help us in our prime years. And you don't have to be alone. You don't have to wonder about if it's out of my reach, because we can certainly help you make sure that we maintain everything that you need within your reach and your budget. So there's so many different things we can do, and just being able to have a quick conversation with me. I have 37 years experience working with the geriatric population, from hospice to orthopedics, and I can certainly try to answer all of your questions. And if I can't answer them, I have community partners that I can reach out to.
You know, that's the other point that you bring up that is so important, is that experience matters. We were talking about one of the problems with aging is it's on-the-job training. You know, you don't know until you get there. And so the very fact that you can take advantage of the experience that people have, it's why you do choose an expert. Like if you were looking legally, you try to get an expert attorney in the area that you're thinking about. Or if it's a financial question, you're going to try to get a finance expert who's been down that road before. It can help you make those decisions. And that's why it seems so important when you're talking about getting home health and help at the home, to call somebody that really has that level of experience, not only with that industry, but digging deeper into the whole side of geriatrics and all the things that we need as we get older.
Well, oftentimes people will wait to the very, very last minute that they need care when someone is now no longer ambulatory and there's no one here at all, and they need to be cared for and they're bedbound. And it's like, okay, now I need help. Well, we're here to get involved in the early stages as well of retirement, just so that we can have everything aligned and set in place so that they can age in place successfully and be long-term, and not just age in place during the golden years, but also in the latter senior years, so that we have everything set in stages and in place. And it's so beautiful to see just how much more value that it can add to someone's life.
Hey, there's no question about it. And now that we've talked a little bit about the things that home health care can accomplish, let's talk a little bit about those 5 tips that we talked about helping you find the right in-home care provider. And the first one we wrote down, and I want you to talk about a little bit, because we already touched on this, was assessing your in-home care needs.
Absolutely. So that's why we offer a free, no obligation consultation. You get to meet with me personally, one-on-one. I get to come in. I can schedule a time to meet with a client themselves, or if they want a family member present. I am available literally 7 days a week, evenings, whatever your schedule is, I can make sure that I'm available to you. And really sit down and talk about in detail and elaborate more on all of the things that we just touched on. But how does it impact their need? How can I help the client and the family meet their needs? And also, maybe they're not even sure what they are. So by doing that free, in-home, no obligation visit, I can get a clarity on their environment and the situation, and get to learn about the family and build that rapport, so that I can find out what the needs are, and I do a full assessment need list, and I'm taking notes, and I'm learning, and I'm able to answer all of the questions. We do a walkthrough of the home so I can see the living areas and learn about those safety hazards that may be lurking that we're not aware of, and just kind of find out, how do we get the most value out of our services, and make sure that we're scheduling the right amount of hours so that we're not under or overutilizing their resources. And
that goes back to that number that you had said, really stuck in my head, about you have 37 years worth of experience in this area and this way of thinking. So you really become a valuable resource when you sit down with a family and say, well, I can look over 37 years and say, these are the things you guys want to think about. Let's talk about the second step. The second, I guess we would call it the second tip, is you got to know your budget. And I guess one of the problems for most of us is this whole concept of having somebody come in the home is new to us. We don't necessarily know what this is going to cost. We don't know if we can afford it. We don't know if there's any way that we can get any help with it, and how much we need. Absolutely, and that's why the in-home assessment is so important.
So we really looked at all of the assessment and what is needed, and how many hours of services that were needed, and how many of personal care, if we need companion, respite, if we need homemaker services, we identify what services are needed or could be beneficial, and then we develop a cost. So every case is different. Some require more services, some only require one or two, and we average around $17 an hour for our services, and we like to do a minimum of 4 just because there's so many things that we can get done in 4 hours and set you up, and you actually could need less days if we provide at least 4 hours of care.
Right.
So 1 to 2 days is absolutely amazing and works very efficiently for someone new to services and not quite needing full care.
Right.
And that's a great way to, again, if somebody's just super busy and they don't have time to go out, like I said, and go do grocery shopping and meal planning and all of those things, and just getting laundry done and things kept up in our home. And just being there to provide those companion. I mean, we have our caregivers will sit and play their favorite game or help them with their activities or their crafts. I mean, it's just a great way to just bond with someone in your own home and actually have someone kind of enjoy your life.
You know, that's a whole nother point that you just brought up when you were talking about 2 areas. One, we get a lot of information about seniors feeling isolated, and so if they're staying home, then what are they doing besides watching TV, you know, or something that just basically doesn't give them a chance to get out of themselves for a moment. And so it seems like it's very healthy for that. And the other thing that I thought you just mentioned, which sounds very healthy, is maybe you are the adult child of a mom or dad, and you're doing the best you can as the caregiver to be there as much as you can, but you have to go to work during the day, or you have to do this with the kids during certain parts of the weekend or things like that. And now you're talking about respite care that's going to be the hand that comes alongside and helps those folks.
Absolutely, and that's a great benefit, is that we give everybody an opportunity to have a productive life with balance. We all need a mental health break, and we need to have that balance. Everybody deserves an opportunity to have a little me time, and not feel like they're pulled in 10 different directions. As you know, if you're traveling between counties or just across I-95, or
right.
The traffic can be a nightmare, and it's not like you're going very far, but you could be stuck in traffic 2 hours a day.
Sure you can.
And so, like, say you leave for work at 8 o'clock, but you don't return home until 6. Well, if you have a loved one that needs care, that's a lot of hours to be alone.
Yes.
So we can time that to maybe we come in and we help from 10 to 2. We're there in the middle of the day. We can, because a lot of our seniors, I know that they like to sleep in a little bit. They've earned all that time getting up at 5:30 and 6 o'clock in the morning. They like to have their morning time and make it slow and easy getting up. So we can come in and, for instance, start at 10 o'clock. We can help them get breakfast, help them get set up for the day. We can also, before we leave, make sure they have lunch and they're ready and they're all set and they've been cared for. They've had a lot of things accomplished in the home. And so when the family returns from the workday, they don't have to worry and they're not stressed. So if they do get caught in traffic, they're not having to rush because they know their loved one has already been taken care of.
And that's so important. So let's move to the third thing that we wrote down here, which was that finding the in-home care agency. So I guess that's the next thing. If you're thinking about this and you're sort of assessing it, then you're going to say, how do I find the right in-home care agency?
Well, one of the first most amazing resources in our community is we have Helping Seniors of Brevard.
Yay!
That 75 to 100 calls that you get per month, those are from our clients and from people who need care in our community. You're going to ask family, you're going to ask friends. You can certainly just, Google, and if you're going to make a list of people to call, you want to make sure they're licensed and they're accredited, because we are.
Yes. That is, again, that comes back to that. A lot of people will see a business card on a cork board at a local store or something and say, oh, that's my solution. And then the problem is if they call and the number might sound attractive, oh, we'll come in and we'll do this for this number. But I can tell you, we've done TV shows with our state attorney, and they talk about some of the problems that seniors run into with scams and things like that. And usually, unfortunately, what they term as elder abuse, which is scams and frauds, has often to do, it's a person that the person knew or invited into their home. Either, unfortunately, sometimes it's a family member, but we hear a lot of not so good outcomes about these stories where somebody just, oh, I can come in and clean your house and that's all, and they clean your house out.
Well, that's the whole point of because we have the licensing and we have the accreditation, we're held to a much higher standard. So that means our caregivers that we bring in that are certified nursing assistants or they're certified home health care aides, they have to be licensed and background checked. They have a level 2 background check that has to be clear. We work with the Officer of Inspector General to make sure that they have a clear background with them as well. Also, the National Sex Offender Registry. They cannot be anywhere on those lists. So we want to make sure they haven't been arrested, that they have no sex offender history, no elder abuse at all. And we make sure that we're sending honest, viable people that are in the system and trackable before we let them enter into one of our clients' homes.
That's so important. So let's go to the fourth tip. The fourth tip is now we've found maybe a list of people we want to talk to, but how do we interview them? How do we know how to make the right decision?
Well, what's so great is that, again, for our agency, you would get me, the administrator who comes out. Oftentimes, I'm able to bring a caregiver with me that you'll get to meet in advance, because I do something very special that he's going to talk about next, and that's about our matching system.
Making the right match. That's tip number 5, folks. Go ahead. Tell us how you do that.
It's so cool what we have with our software program that we do. So we have we can do matching by distance. We can do matching by ethnicity or languages or pet friendly, or someone just to make sure that we have the right personality type. Maybe you have a client who is an introvert. You don't necessarily want to put a client in there who's super extroverted. Sometimes it clashes a little bit and it exhausts the client. So you want to get someone who's maybe a little softer spoken, a little more nurturing, and has a very calm disposition. And we can do all of that because when I interview our caregivers and they pass all of our initial criteria up front, because I don't even really speak to them until they passed all of our background checks. And then I actually take an interest and get to know our caregivers. And I think that is the number one recipe for success.
So that's really the point that we have to do, is you take your time to get these people matched so that there is a good match. So once everybody's in the home, it's really it's a fit for success, I guess. We are literally just about out of time. I want to make sure we give your phone number. How do we get in touch with you now that we found the right home care provider?
Sure. Our number is 321-677-2577, and we serve all of Brevard County.
And thank you, viewer, for joining us today on Helping Seniors TV.
Stackler, thank you for joining our program today. I'd like to remind you that our senior information line is available to you at 321-473-7770. There you can get help and direction that could be helpful for your specific situation or circumstances. The work of helping seniors is very important, but we can't do it alone. That is why our sponsors here in Brevard County are so important. I'd like to thank our many area sponsors, businesses and medical providers who support the mission of helping seniors that help us carry the cost of our media efforts. If you'd like to join us either as a business partner or simply donate as an individual, we would welcome your call at 321-473-7770. You are always welcome to visit our website at www.helpingseniorsofbrevard.org. Thanks so much for your help. It does make a difference.